for this part of the year. We're going to be skipping the summer, but we're going to be having a presentation in the fall regarding nursing homes. So watch for more details for that. I'd like to turn it over to Dr. Renee, who'll be facilitating tonight and introducing our speaker. Dr. Renee, please take it away.
Thank you very much, Mark. Good evening, everyone. And this is from our Community Board 6 Asian Social Service Disability Community Committee, and we're doing this webinar. I'm moderating today, Dr. Mimera, and our speaker is from LiveOnNY New York, which is a federally designated organ procurement organization for the greater New York City area, which includes the 5 boroughs, as well as the lower Hudson Valley and Nassau and Suffolk counties in Long Island. And the mission of LiveOnNY New York is to help New York live on through organ and tissue donation and to care for the families that are touched by the donations. A little bit about our speaker for today. It's Frida Hussein. She's the Queens Community and Government Affairs Liaison for LiveOnNY New York. She has 8 years of experience in Queens federal and state offices, having served as Chief of Staff to Senator David Weprin and in the offices of Senator Toby Ann Kavinsky and Congresswoman Grace Mann, where she's covered everything, state and federal. Ryder graduated from New York University with an MA in politics in 2016, and she specializes in research, writing, and liaising between various groups. She's a lifelong Queens resident and is very passionate about working with the community to improve the conditions in the borough and enjoys exploring diverse neighborhoods and cuisines in her spare time. Great. Over to you, Ryder, because we're going to be talking about the need for organ donation and how does someone get on the transplant waiting list, and most importantly, how does the process of organ donation work? And we want to clarify some organ donation myths with you. Over to you, Ryder.
All right, thank you so much for your introduction, and thank you again for having me tonight. I'm very flattered that I'll be the last presenter for this committee before your much deserved summer break. So let's get right down to it. Here are the facts about organ, eye, and tissue donation. If I'm able to skip to the next part of my slide. Okay, so tonight's agenda, as was mentioned, the need for donation, how you got on the transplant waiting list, and how exactly this process works. The fourth item, clarifying organ donation myths. That's very important because there are so many different urban legends and myths that people hear about organ donation, either through TV, I messed it up, TV or rumors circulating online. So it's very important to dispel all these different myths. All right, so as mentioned in the intro, LiveOnNY New York, we save lives, provide comfort, and strengthen legacies through organ, eye, and tissue donation. We do this by working with multiple partners. We work with local hospitals and transplant centers to deliver the gift of life. In our area, that is more than 100 hospitals and 11 transplant centers within the greater New York City area. We also care for the families of the organ donor heroes who selflessly given the gift of life. And we advocate on behalf of those who are waiting for a transplant. We also educate the other members of the community about the power of donation. So my colleagues who represent the other boroughs and other counties in our area are also going out to the community boards. They're partnering with local elected officials, civic organizations, schools, whatever venue we can to do educational presentations and tablings at health fairs and such. We also have an amazing group of volunteers, more than 100 volunteers who speak about organ donation from their personal perspective as either transplant recipients who are given a second lease on life through organ donation, or as donor family members who talk about the legacy that their loved ones left through organ donation. So this is our donation service area, also known as our donor service area or designated service area, our DSA. Again, as mentioned, all 5 boroughs, Nassau and Suffolk, and the lower Hudson Valley. So this is an area that includes more than 13 million people. And the way that organ donation works throughout the United States is that there are approximately 100,000 people total waiting for an organ donation. In New York State, there are 9,000. And there are 57 organ procurement organizations, or OPOs, throughout the US. So those are, as mentioned, the federally designated nonprofits that all hospitals are obligated to call in case there's the potential for organ donation. Each state has at least one, and larger states like New York have more than one. New York has 4 states, and we're the ones covering the four states. Sorry, New York State has 4 OPOs, and we're the ones covering the downstate area. So there are nearly 9,000 New Yorkers waiting for an organ transplant. And of those 9,000, 8,000 of them live in our area. So we're the ones handling the bulk of the need for organ transplant in the organ ion tissue transplant in New York State. And you can see on this slide the breakdown by organ, what is needed the most. So kidney is number 1, and then going down from there. One thing I like about the slide is that Lauren here is credited as a heart recipient. Previously in our promotional material, she was credited as Lauren, a mother in need of a heart. So that is an example of the tangible impact that we have on people who need these life-saving transplants. The need in communities of color. So in our DSA, the Greater New York City area, 75% of the transplant waiting list is comprised of people of color. So while people of color are more likely to need a life-saving transplant, we are less likely to choose organ donation as part of our final wishes. Due to the history of medical racism within this country, there is genuine concern that people of color are not going to receive adequate treatment, that they're not the ones who who are getting these transplants. And we like to emphasize that in New York City, people of color are the majority who on our waiting list, and they're the majority of recipients in our in New York City. And I'd like to highlight the story of Anita. As you see, she's a cornea recipient and living liver donor to her father. So Anita Moore is a detective in the Bronx, and she had keratoconus. She had like an inflammation of her cornea that impeded her ability to see. So she needed the gift of cornea transplant. And after having received that cornea transplant, she was in the unique position of also becoming a living donor to her father. She was able to donate part of her, a lobe of her liver to her father. So that's her experience as both a transplant recipient and a donor, and an example of, how people of color in New York City are getting the care and treatment that they need with regard to organ transplant. So one donor can save up to 8 lives and improve up to 75 lives through tissue donation. So they can save 8 lives through the donation of vital organs such as the heart, liver, kidneys, lungs, pancreas, and intestines. And they can enhance up to 75 lives through the donation of tissues such as cornea, as mentioned earlier, as well as bones, heart valves, tendons, skin grafts for people who are burn victims or people who need reconstructive breast surgery after getting mastectomies. So even if an individual is not able to donate vital organs at time of death, they can still enhance lives through tissue donation. The need for action. Only 45% of New Yorkers are registered organ donors. Low registration rate has led to an organ shortage. Due to the shortage, people who need transplants have to wait longer. And tragically, a New Yorker on the transplant waiting list dies each day. So, for example, in the United States, the typical wait for a kidney is 3 to 5 years. But in New York State, because of our low registration rate, we're like around the middle of the pack, in terms of registration rates. So people in New York can wait up to 5 to 7 years on for a kidney. So that means more time on dialysis, more time with kidneys that are failing. So that's why it's so important for us to go out and to talk about this topic and make sure that more people are registered. Understanding the organ donation process. There are multiple conditions that can lead to the need for an organ transplant. For example, people with diabetes and hypertension could end up requiring a kidney transplant. Someone could have a liver transplant through untreated hepatitis and cirrhosis. And congestive heart failure and cardiomyopathy are conditions that could require a heart transplant. Registering on the transplant waiting list. To get on the transplant waiting list, the doctor must refer you to a transplant program as a potential candidate. The transplant center collects the details, and they then conduct an evaluation to find out if the patient is a good candidate for transplant. If the transplant determines that you're a suitable candidate, they then add you to the national transplant waiting list. So the reason why this is such an involved process is because there are so many different factors that could lead to an organ rejection. And they want to make sure, because there's such a shortage of organs, they want to make sure that whatever organ is transplanted does get its full use. So they want to, when they do these appointments, it's, they do psychosocial, medical evaluations. They want to make sure that you're capable of following doctor's orders, Can you stick to a diet and exercise regimen? Can you take the immunosuppressant medication for every day? Because otherwise, if you don't take this medication, your body will literally reject the foreign organ inside you. So that's why this is such a rigorous process, to make sure that the person who's on this waiting list is capable of adhering to all these rules, to make sure that their organs aren't rejected afterwards. How does someone become an organ donor? So this process most often begins by a person signing up directly in their state. As you can see, the most common way of signing up is at the DMV. We partner with the DMV regularly to promote organ donation. And you see, like, you have a little heart on your driver's license, but there are other ways to sign up, including registering to vote, getting your ID NYC over here in the city, getting a health plan at the New York State of Health official health plan marketplace, or you can just sign up directly online. What if someone doesn't sign up as an organ donor? If someone hasn't signed up as an organ donor at time of death, donation is still possible. So this is still possible through third-party consent. Family members or other authorized individuals can make donation, can authorize organ donation on a person's behalf. And so this list includes the hierarchy of who gets to make this decision. Healthcare proxy is number one, spouse or domestic partner, and then going down from there. In fact, most donations in our designated service area are made through third-party authorization. So here I live in New York, we have family support advocates who speak to families and do so in a culturally sensitive manner about the topic of organ donation, when that time comes. How does organ donation happen? Organ, eye, and tissue donation only happens when a patient dies in a hospital and has been declared dead by a doctor. So as mentioned before, either the person that signed up as an organ donor or authorization was made by a family member or legal guardian on the patient's behalf. Candidates for donation must have been placed on a ventilator prior to death or have died while on a ventilator. And this requirement often surprises people, because when I'm doing these presentations, people are like, okay, if all these people have signed up as on the registry, then why do we still have such the shortage? And that's because you need to have died in this very specific manner on a ventilator. You can't just, if you pass away in any other manner, what happens is your organs are no longer receiving oxygen, blood is no longer pumping, and your organs they become damaged, and they're no longer in a position where they can be transplanted. If you're on a ventilator at time of death, then oxygen is still being pumped and your organs are in a position where they can be recovered and transplanted. For other cases, there are times when you can die in a way outside being on a ventilator, and you can still get tissue donated, but then that would require your family to call the coroner as soon as possible to make sure that recovery happens. And afterwards, extensive testing is performed to make sure that the organs are healthy and to identify a matching transplant recipient. How are organs matched to transplant recipients? Several factors are considered. You need to have a compatible blood type and compatible immune systems. Body mass is an important factor. For example, a child in need of an organ needs to have an appropriately sized organ for their smaller body. Rank on the national transplant waiting list, and geographic proximity between the donor and the recipient. Organs only last for a short amount of time outside the body. Hearts can be 3 to 6 hours. Kidneys can last up to 3 days, but that's still not enough time. That's still not a large window of time. So time is of the essence when transporting organs to people who are waiting for this transplant. And again, information gathered from medical tests are used to identify the best match. And it is illegal to make organ donation matches based on race, gender, religion, income status, social status, or celebrity. This means that if Kim Kardashian were to ever need an organ, and she would not. She'd be expected to wait just like everybody else. Once you were on that list, you were given a unique identifier. None of these other factors that I listed are used to, race, gender. They're not used to move you up. The only things considered are, again, what I mentioned: blood type, body mass, etc. So, organ donation myths. I'm sure you can guess, some of the myths I'm going to cover, because there are just so many different urban legends regarding organ donation. The myth, and I feel like this is the number one myth: doctors won't try as hard to save me. This is why people don't want to have the heart on their license. It's why they're reluctant to sign up. The truth is that all hospital staff, doctors, nurses, EMT workers, they do everything that they can to save your life. This is their ethical and legal obligation. No doctor is going to fish around in your pockets, see your license, and say, oh, she has a heart on her driver's license, we're just going to let her die and have her organs transplanted. That does not happen. And the team who treats patients, they're not affiliated with the same team that recover organs. So again, there's no conflict of interest there. Your quality of care will not be compromised just because you sign up as a donor. The myth: organ donation is against my religion. The truth is that many major religions celebrate organ donation as a way to save lives, including Buddhism, Judaism, Christianity, Islam, Hinduism, and Catholicism. Organ donation is often seen as a final act of kindness and generosity. And we do encourage people who do have questions and concerns to speak to their local religious leaders. So, Mark, I will get you the Orthodox Jewish information that we have that's specifically geared towards that community. The myth: I'm too old, I'm too sick to be an organ donor. That's another thing that I see commonly when I am out in the community. People will approach me and they say, oh yeah, I'd love to be an organ donor, but you don't want my sick old organs. They're no use to anybody. And what I like to tell them is that there's no age limit for organ and tissue donation. The oldest donor on record in New York State was 93 years old. That person was able to donate their liver, and that liver is maybe more than 100 at this point. But yeah, so never discount yourself. You're never too old or too sick. Anyone and everyone can sign up to be a registered organ and tissue donor. Medical history is always reviewed at time of donation to determine a match. And there are ways to work around certain syndromes. For example, in 2013, President Obama signed the HOPE Act. And this allowed people who are waiting for a transplant, who are HIV positive, to receive organs from an HIV positive donor. So that was a way for them to be able to get off the organ transplant list. So again, we're able to work around all sorts of conditions. The myth: I will be able to have a normal funeral. The truth is that organ and tissue recovery for donation are very serious surgical procedures. They're done with the utmost care and respect, and open casket viewing is still possible. We work with families' timeframes for burial. The myth: my family will have to pay. The truth is that families of an organ or tissue donor, they are never responsible for the costs related to donation. All costs are handled by the organ procurement organization. So in our area, that would be LiveOnNY New York, or in other parts of the US, that would be the organ procurement organization for that respective area or state. And people who are receiving transplants, they have their medical insurance to cover. Sorry, can you hear me? Yes, no? Okay. All right. Okay. So yeah, so they have their medical insurance to cover the costs relating to transplantation. Happy to help? Talk with family and loved ones about organ donation and your wishes. Obviously, this is a very uncomfortable topic, but it is something important to know because, quite frankly, you never know what could happen. And it's really helpful if your family knows what your preferences are in case a situation like this comes up. Sign up to be an organ and tissue donor, at any of the venues I mentioned earlier in this presentation. Share what you learned today with others, and volunteer in community to educate the public. Thank you. For more information, visit liveonnewyork.org. Let me stop this presentation.
Thank you so much, Ryder.
Thank you. Do you have any questions for me?
Yes, let me ask you first. It says in your PowerPoint that you have 45% people registered in New York. How are you expanding the registry? Because we definitely need more people in the donor program, in the LiveOnNY New York donor program. And second is that there are many now biracial families in the country. So how do you address that issue when you're looking for a donor?
Okay, so your first question was how do we plan on expanding the registration rate? And your second question was how do we account for biracial individuals in our donor? Okay, so yeah, so our initiatives, we do education to talk to people about organ donation. This is an ongoing project because it's never overnight. Most of the time, if at least we try to make sure that people at least think about the subject so they're not as frightened of the topic. Again, we dispel the myths. We talk to them about the fact that no, the doctors don't let you die. So that is an ongoing. That's why we have our community and government affairs department to reach out to organizations such as yours and to do education. So again, that's more longer term and ongoing. We also try to make it easier for people to register. We always do more to open up different portals for registration. So for example, at the DMV, that's just comment, very easy, just check out the box. No need to think twice about it. We're also working with the state on, say, when you're getting your fishing license, if the option for organ donation. So any possible path where you're interacting with the government, and we can have that as an option where people can sign up as donors. And as for your second question, so the way that we track the who receives the racial demographics of who is receiving the transplants as well as who is on the waiting list. But in terms of our donors, because of donor form, when you sign up to be a donor, that it doesn't ask for race, right? It doesn't ask for those factors. So we don't necessarily have a way of immediately tracking the race of who is who's signing up as a donor. You know, you can get a transplant from anybody. That's not race specific, but the issue is that just in terms of certain compatibilities, you know, it is easier to make for a more compatible match between a donor and a transplant recipient of the same race. So we do have certain factors for calculating at least who's receiving these the transplants, who's on the waiting list. I don't know about specific data regarding multiracial individuals. That's something I'd have to.
My question was, is it a challenge to find a match if somebody's coming from a biracial background in terms of matching in the transplant? Because otherwise there might be a rejection, even though you're giving them steroids and immunosuppressants.
Okay, so I would not know about specific challenges. I have to look into that further. So I'll email you and ask and get more information on any challenges for biracial or multiracial individuals in terms of getting a match. Thank you. Any other questions? Yes, Latrice.
Hello, and thank you for the presentation. I am a registered organ donor, and unfortunately, I am, you know, the big C is prevalent in my family. My father died of colon cancer, and my mother died of pancreatic cancer. And I saw the display where it mentions the organs. So, like, let's say I'm cancer free. I've never had it. God willing, it'll stay that way. But, you know, as an organ donor, let's say, God forbid, I end up with cancer of the pancreas or of the intestines, the colon. Would those organs still be viable for donation? And if not, what would happen to the rest of my body?
Okay. Again, I'd have to look specifically. I would say no. If you've had cancer in those organs, I don't feel that they would be viable. Again, I'd have to look specifically into this. But again, they do testing of all relevant organs, and they test for all different syndromes. So even if those organs, specifically the colon or the pancreas, are still not viable for transplant, there are other organs that could still be. And again, tissue is always something that can be donated. Cornea, for example, you don't even need to like have you know, same blood type or anything like that. So I'd have to look further into what would happen if you had cancer in those specific organs, but they should be able to make sure that at least test for whether those the unaffected organs are viable for transplant.
And I'm just curious because I learned something today in the presentation tonight about being on a ventilator. My parents were not on ventilators when they passed away, and so okay, obviously, you know, the organs that were affected by cancer would be out of the question. But what about other organs, say my dad's heart or my mom's lungs? Like, would those be viable? Because they were not. Again, you know, my mom died of pancreatic cancer, not lung cancer. So would the lungs still be salvageable?
Right. So yeah, because they were not on a ventilator, then that means that they were still not receiving oxygen at time of death. So that meant that the organs were going to be damaged. They experienced what is called ischemic injury, and that's the kind of damage that they get from from no longer having blood pumped into them. So those organs would not have been viable at the time of death.
So, okay, in my case, I am an organ donor. Let's say, God forbid, I end up with the same fate as my mom or my dad. What happens then? Because I'm listed on my driver's license and my ID NYC card as an organ donor, but you're saying my organs are not going to be usable. So what happens then?
Yeah, so if you're not on the ventilator, then unfortunately your organs, they're just not in a condition that is suitable for recovery. That's why we have such a shortage, because like the truth is only 1% of people die on a ventilator. So that's such a very specific set of circumstances. And it means that if you die in any other manner, unfortunately the organs are just not in a position. They experience too much damage from time of death afterwards, unless you're on a ventilator. Sorry, there's traffic going on outside. I apologize if you heard that. Yeah, so they experience too much damage after death outside of a ventilator.
That brings me to another question I have. Like, as you know, COVID is not over, and I still take precautions accordingly. And so I know a fair amount of people who died of COVID were on ventilators. If they were organ donors, what happened to them? I'm just curious to know.
Yeah, that is a really good question, because when COVID first hit, organs were not being accepted from people who died by COVID. We just did not know enough about the disease at the time. But now, currently, lungs, if you die from COVID, your lungs are not acceptable for transplant. But what they found is that they test for other they test for other organs, and they do not find COVID present in those other organs. Then those organs are suitable for transplant. And of course, the person receiving, anytime a person is offered an organ, they do have the right to say no if they feel that they're not comfortable with that risk. But but what's happening right now is that people who do die from COVID at this moment, their organs besides lungs are still tested. If they don't find COVID there, then those organs are considered suitable for recovery and transplantation.
I think I've taken up enough time with questions.
Great questions. I really appreciate you.
My fellow attendees.
Yes.
If I think of anything else, I will throw them out. I will throw the questions out there. Thank you for the information.
I'm here to answer questions. Yes.
Also, Ryder, how much percentage of people get rejection from the transplant? Is there a percentage? And then what is the survival rate after that?
Yeah.
So that would differ by individual organs. Like, so I'd have to look more specifically for rate of your questions were rate of rejection.
Yeah. I think the top one is the lungs, if I'm not mistaken. That's the top one.
Yeah. And survival rates. Okay, so I'll have to get specific data for for each organ. And I know, Mark, you had a question?
Yeah. The question, I'm a social worker and I worked in nursing homes and hospitals. And I know the challenges it is to approach people about healthcare proxies. I used to approach people about healthcare proxies, and I used to get a lot of the time I used to get, "You want me to die?" So I'm just curious to know the approach that you use. I mean, I assume you can't approach somebody and just say, "Hey, you want to give your organs away." I assume there has to be a more gentle, more empathetic approach. So I'm just curious to know, like, how when you're trying to encourage somebody to do this, what's the approach that's used?
So and yes, we have worked with institutions like advanced care planning to talk about how to mark somebody as your healthcare proxy, and how to actually mark on the document that you do want your organs transplanted. When you say how do you approach, do you mean talking about my job, like approaching people in the community, or the family support advocate's job, talking to family members about organ donation? Just for clarification.
I'm sorry. I guess again, well, the work that you do. I mean,
yeah.
Do you personally speak to people, or are there volunteers or people who actually go out in the field and talk to people about this to encourage them to do it?
Yeah, so I and my other colleagues in the Community Government Affairs Department, we talk to people at venues like this, or we're just tabling, and yeah, the reaction you get is very interesting, because sometimes people will just see me with my tablecloth that says "Live on New York, organ donation saves lives," and they see the slogan and they immediately jump back, and I'm like, okay. Sometimes they try to avoid making eye contact with me, like I'm gonna take their organs right then and there. But yeah, other people when they do. It's helpful when they approach with at least a curious attitude. Like, some people are honest and they say, like, look, I'm not comfortable signing up. I'm concerned about them harvesting my organs. Another thing is that we don't use the word harvesting, we use recovery, but the average person will use the term harvesting. And so I try to talk to them. I ask what are their concerns. I talked about the fact that, again, doctors, they don't know your organ donation status. They don't have access to the information. Your quality of care is not compromised. I walk them through whatever questions and concerns that they have, and in a non-judgmental way. My job is that I'm not like forcing people to sign up right then and there. I want people to learn the information and approach me with any questions that they may have. So when I'm tabling at events, I have various forms in multiple languages. So English, Spanish, Chinese, Korean, Russian, Bengali, Haitian Creole. We have forums aimed towards people of like different religions. So again, Orthodox Judaism, Reform, Conservative, Catholicism, Hinduism. So we really do try to address the concerns of people from all sorts of angles, any kind of religious or cultural background that we have that they may have, and any questions that they have with regard to organ donation.
I also have a technical question. So again, as I mentioned, I used to help people fill out healthcare proxies. I do know that you have to indicate in your healthcare proxy whether you want your proxy to make decisions regarding artificial nutrition, hydration, or respiration. I know if you don't have that, then those decisions are reserved by the medical community and the ethics committee. My question is, do you have to specify in the healthcare proxy that you're giving your proxy the power, or it's one of the many other powers? It's under kind of like more of a general rubric.
I honestly, I'd have to look back at the form again to see with respect to the healthcare proxy form.
Actually, I think I'm sorry. I think I do remember there is a check off on the proxy.
Yeah, they do have a specific form. The question is that sometimes people, there's sometimes a question about like, if I say that I don't want to have my organs donated on my healthcare proxy form, but then I later sign up separately at the DMV, like which supersedes the other? Because there are so many different venues and avenues to indicate that whether you're an organ donor or not. So I think in some cases it would be based on, what was the most recent form? But yeah, like as you said, there is a little check off on the form with regard to organ donation.
I think on the healthcare proxy is actually a little that you can check off if you want your organs donated.
Yeah.
I guess if you check off no, then the healthcare proxy doesn't have the power to make that decision.
Right. If you check off no, then that is respected.
Right.
Yeah. Any other questions? All right, thank you. You've been a very engaged and inquisitive audience. I really enjoyed presenting tonight, and I will get you the information and the questions that you asked me tomorrow. All right?
Right. And I'm also interested, again, I'm curious to see your information about for the Orthodox Jewish community. I'm really curious. Okay. I'd like to share it with some of the people that I know.
Excellent. We have pamphlets that I can actually have arranged, mailed over to Community Board 6 if you'd be interested in that.